Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Parasitic infections, a global health concern, affect millions worldwide, particularly in areas with poor sanitation and limited access to clean water. Among these parasites, Trichuris, Trichiura, and Echinococcus granulosus stand out, causing significant morbidity in vulnerable populations. This essay delves into the causes, symptoms, diagnosis, treatment, and prevention of these parasitic infections, emphasizing the importance of awareness and public health interventions. These parasites, though different in their life cycles and modes of transmission, share a common thread. They thrive in conditions where hygiene is compromised. Understanding their intricate life cycles and the diseases they cause is paramount in our fight against these preventable infections. By shedding light on these parasites, we aim to empower individuals to protect themselves and their communities. Through this exploration, we hope to foster a sense of responsibility and encourage proactive measures to combat these parasitic infections. By understanding the enemy within, we can build a healthier and safer world for everyone. Trichuris trichiura, commonly known as the whipworm, is a parasitic roundworm that infects the human large intestine. Its name comes from its characteristic whip-like shape, with the thinner anterior end resembling the whip's handle and the thicker posterior end resembling the lash. This parasite, measuring 30 to 50 millimeters in length, attaches itself to the intestinal wall, causing discomfort and disrupting normal gut function. Transmission occurs primarily through the fecal-oral route, highlighting the crucial role of sanitation in preventing its spread. Ingestion of contaminated food or water, often due to improper hygiene practices, introduces the infective eggs into the human host. Once ingested, the eggs hatch in the small intestine, releasing larvae that mature and migrate to the large intestine, where they burrow into the lining and complete their life cycle. These worms, though small, can have a significant impact on their host's health, particularly in children. Understanding the transmission dynamics is crucial in implementing effective control measures and breaking the cycle of infection. Diagnosing whipworm infection involves identifying the characteristic eggs in a stool sample through microscopic examination. This relatively simple and inexpensive method allows healthcare professionals to confirm the presence of the parasite and determine the appropriate course of treatment. Early diagnosis is crucial in preventing complications, especially in heavily infected individuals. Treatment typically involves antiparasitic medications, such as albendazole or mebendazole, which effectively eliminate adult worms from the intestine. These medications work by disrupting the parasite's metabolism, leading to paralysis and death. The dosage and duration of treatment vary depending on the severity of the infection and the individual's overall health. In addition to medication, supportive care, including adequate hydration and nutritional support, is essential in promoting recovery and managing symptoms. Addressing any underlying malnutrition or intestinal inflammation further aids in the healing process. Section 4. Echinococcus granulosus, the silent threat of hydatid disease. Echinococcus granulosus, a small tapeworm residing in the intestines of dogs and other canids, poses a significant threat to human health. Unlike Trichuris trichiura, this parasite takes a more indirect route to infect humans, involving an intermediate host, often sheep or cattle. Humans become accidental hosts through contact with infected animals or ingestion of contaminated food or water. Once inside the human body, the tapeworm larvae migrate to various organs, primarily the liver and lungs, where they form slow-growing cysts known as hydatid cysts. These cysts, filled with fluid and parasitic larvae, can grow silently for years, often remaining undetected until they reach a significant size or cause pressure on surrounding organs. The symptoms of hydatid disease vary depending on the cyst's location, size, and rate of growth. Abdominal pain, discomfort, and swelling are common, along with coughing, shortness of breath, and chest pain if the lungs are affected. Early detection is crucial in preventing serious complications, such as cyst rupture and anaphylactic shock. Section 5. Prevention and awareness, protecting yourself and your community. Preventing Trichuris, Trichiura, and Echinococcus granulosus infections requires a multifaceted approach, targeting both personal hygiene and environmental sanitation. Promoting hand washing with soap and water, especially before eating and after using the toilet, is paramount in breaking the fecal-oral transmission route. Properly washing fruits and vegetables and ensuring access to clean drinking water are crucial in preventing ingestion of parasite eggs. Controlling stray dog populations and deworming pets regularly play a vital role in interrupting the transmission cycle of Echinococcus granulosus. Educating communities about the risks of contact with infected animals and promoting responsible pet ownership are essential in minimizing the risk of transmission. Raising awareness about these parasitic infections and their modes of transmission is key to empowering individuals to protect themselves and their communities. Public health campaigns, educational programs, and community engagement initiatives can significantly contribute to reducing the burden of these preventable diseases. By working together, we can create a healthier and safer world, free from the threat of parasitic infections.